All right, this is the Ober's test, modified Ober's test, and Thomas test. So we'll do the Ober's test first. I'll have my patient side lying on the treatment table on his unaffected side. I'll make sure to stabilize the patient on the treatment table. And what I want to do for the Ober's test is stabilize first at the hip, and then I will grab under the affected extremity, make sure to stabilize the knee so that I'm not causing any stress at the joint there. I want his hips to be in about 90-90, his hips and knees to be in about 90-90. So I stabilize his hip in neutral, and then I passively bring him into abduction, extension, and then I allow his extremity to drop. Negative test would be like this: when his affected side is able to drop all the way to the treatment table. Positive test would be if it is unable to adduct past neutral, it just stays raised up. So that would indicate tight TFL and IT band. So there's Ober's test. Modified Ober's test is the same thing, except instead of flexed at the knee, you would just perform that with the entire leg straight. And now we'll move on to the Thomas test here. So in order to do the Thomas test, you'll have your patient short sitting at the edge of the treatment table. I'll ask my patient to grab under the knee of the unaffected side, and then slowly tell my patient to lower down, and I can help my patient down safely. And what you want to test is the side that they are not holding. So this would be a positive test when the thigh of the affected side is unable to drop down to the table. This could indicate a tight. A negative test would be if it does drop down to the table. A positive test is if it does not, such as this. This could indicate that he has either a tight rectus femoris muscle or a tight iliopsoas. So one way we could try to differentiate between the two is I can passively extend him at the knee. If this allows the leg to drop slightly like that, it could point more towards a rectus femoris tightness. If I were to extend him at the knee and it did not drop, that might indicate more of a iliopsoas tightness. So there you go, the Ober's test and Thomas test.